bone marrow stimulation procedure. After carrying out a standard diagnostic arthroscopy and identifying the lesion, the preparation of the lesion is carried out. The basic concepts of a bone marrow stimulation technique are followed. The lesion is delimited to healthy cartilage, including only injured tissue. One technique to achieve this, obtaining vertical margins, is to delimit using an arthroscopic scalpel blade or similar. Debridement is performed with the help of motorized instruments such as a shaver and a sharp open or closed curette depending on the surgeon's preference. With the open curette, we gently scrape the surface of the lesion to remove the layer of the calcified cartilage. Starting at the periphery of the lesion, perforations are carried out. Depending on the tool used, the depth of these perforations can vary from 3 to 9 millimeters and their diameter from 1.2 to 2.5 millimeters. However, the main principle remains the same: to establish a communication between the subchondral bone marrow and the surface of the lesion. Drying of the knee. After the completion of the bone marrow stimulation procedure, the knee is drained from all the fluid used for insufflation of the joint to allow the implantation of the hydrogel, since the surface of the lesion should be as dry as possible. Ideally, the product needs to be taken out of refrigeration about 10 minutes before use. The syringes are labeled A syringe, which contains the catechin solution, B1 syringe containing glucosamine, and B2 syringe containing carbonate. It is of utmost importance to use the total amount of solution of the B syringes in order to reach the desired pH level. The B1 syringe is connected to the connector, and then both are attached to the B2 syringe. With about 10 vigorous pressures of the plungers, the contents of the two syringes are pushed to mix. The upper syringe is then discarded, leaving the connector attached to the lower syringe. The syringe A is then fixed to the free end of the connector. When everything is ready, the content of syringes A and B's is vigorously mixed with 15 to 20 strokes of the plungers. An immediate change in the coloration of the mixture is observed, which becomes more whitish. From the moment when the contents of the A and B's syringes are mixed, time becomes critical, with about 90 seconds for the product to be implanted before the gelling takes place inside the syringe, making it very difficult, if not impossible, to implant. Next, the syringe containing the mixture is attached to the needle, and implantation begins in a slow, dropwise manner, initially trying to cover the entire surface of the lesion with a thin layer of JointRep. And then applying more until the lesion is full, but avoiding overfilling it. With the help of a small flat instrument, the surgeon can try to mold the surface of the implant to obtain a smoother surface. After a couple of minutes or less, when the implant is consistent enough, the knee is extended. Excess fluid is removed and the portals are closed.